starting to get on a lot of medications. Like, do you want that, or what's your goal? Because you're gonna end up like.
I know.
More and more is going to keep adding on. You're going to be then called polypharmacy, where you're on so many drugs, they have so many interactions, and then that creates its own big mess.
We were just talking about that when he was asking me questions of what I would like to see, and I'm like,
oh yeah, so what would you like to see?
I've never been on medication. My mom was like an herbalist, or
really?
Okay. Yeah, she was taught by her grandpa and everything. She only believes in like natural remedies. Yeah. So for us growing up, we weren't given much of anything but what she believed, drinking teas or whatever it would be. So even for me to take Tylenol or anything was difficult. We didn't really do any of that unless I absolutely had to for pain.
Okay.
November is when I first took my first Plaquenil pregnancy. Started December. Yeah. Before that, I took nothing. Now I'm on that list you see. Yeah. 6 are for the heart.
Yeah, I have
not to mention the one for the tongue whenever I need it for the pains. Which I've had to take. Now they're getting ready to start me on the Benlysta infusion treatments.
Yeah.
I would love to. I'm just getting masked with it and not getting something resolved.
Yeah.
It's going to be ongoing forever. This is never going to, I'd love to find a treatment plan that could get me off of this.
Okay. We got to be really careful with your cardiovascular risk factors, because like even dissecting arteries is pretty significant. Some of that could be related to your autoimmunity. I think when I talked to Ben, that wasn't made clear. So you could have the autoimmune response. Mixed connective tissue does impact the vascular system. So just like you have connective tissue in your joints, ligaments, you have connective tissue in your vascular system. So your autoimmunity can be a contributing factor to your cardiovascular issues. It may not just be like, you aren't getting enough movement or exercise, or you're eating too much unhealthy foods or those things. It could just be the autoimmunity itself. So there's a relationship there too. So we have to be careful with, we're keeping your risk low for a cardiovascular issue, and that's where you have to kind of balance out which pharmacology you should have to take, and some of the pharmacology that's just there like for pain and inflammation. Maybe if we can figure out diet and lifestyle and nutrition things that can help that, then maybe you might not feel like you need to take those as often, right? But you kind of have to see where things go. So let me ask you a question. Before, when I was going through your case review, the first thing that really popped out to me was, and I wanted to know more about, was your seizures. So you had seizures since you were in your childhood, right?
Yeah, I don't know much about them. Growing up, my parents weren't ones that we were able to ask questions or medical questions. I mean, basically anything. So I only know because my first pregnancy, I was sick, and doctors started asking, do you have any medical history? Do you have anything? And it was always no, nothing. It's as time goes on, and some of my older siblings, they're like, you were really sick when you were little, don't you remember? No, obviously I was too young. My mom had said that the first time when I was maybe 2 or 1, I was induced in a coma.
Yeah,
but she didn't know why or what the reason being. She just said, and it was just recently, because this all happened to me, that I started trying to ask her more and more. I found out, she said we were actually in Mexico for the first time, because she'd never taken us to Mexico to visit her family, and I'd gotten sick there.
Okay.
And something was happening, and my dad didn't want me there getting treatment, so they brought me back over here. Okay. But by the time I got back, they had induced me. I don't know the cause.
When was the last time you had a seizure that you can remember?
I was maybe in grade school, and I didn't know that that's what it was. I didn't know. I know now that I'm pretty sure that that's what it was, and the reason being is because, when my mom said that I was in a coma, she says I did go in there having seizures. I had seizures during that time. Maybe they could have been febrile. I have no idea.
Okay, no problem.
But when that happened, I can remember being in grade school. All I remember is we were playing. We were always outside, running, playing. All of a sudden, I just remember like waking up. I'd be on the floor and looking around like, what am I doing here?
Okay.
I don't know, but all I can think is that those had to have been seizures. I have no recollection of what happened from playing
Okay.
to when I woke up.
But nothing in adulthood. And Ben, you haven't seen
No.
anything?
No.
Nothing?
No.
Okay, great. Okay. So let's move on from there. Okay. Now let's go into the autoimmunity. So, most people have autoimmunity. It takes a long time for them to finally get diagnosed. And 10 years is a common thing, even longer for people. So you have a lot of degenerative changes that, like you sent me with the MRI, X-rays, so forth throughout your spine, right? And
Yes.
it seems like you were in pain all the time.
Yes.
From very early. So when were you really starting to notice, for example, some of the inflammation and pain in your joints and body?
It was after my last pregnancy.
So at what age was that?
I was 31 when I had David.
So it's been about at least 15 years plus.
Correct.
Right?
I believe I started when I first started noticing and trying to go to doctors for the pains, where it was getting kind of out of starting to affect my lifestyle.
Yeah.
I believe it was in 2011 was when it really started to affect. I needed to know what was causing this because it didn't feel normal.
Okay. So 2000, and where did the pain start? Your shoulders, you said?
Most of it was stiffness in my neck. My neck would just get it felt like it was swollen and stiff, and to move it, especially in the mornings, was very difficult. It would just feel like, I guess there was a lot of inflammation and coming from my back. Started going trying to go to the doctors, and they said it's just normal. It's
okay.
nothing.
And then your spine, lower back, and other areas.
Correct.
And then your hands, are they swollen all the time too?
Yes.
When did the hand swelling start?
Probably 2011. I'd say the worst of it, where everything was noticed, couldn't stop, 2016. And the only reason I remember certain times where I did end up in ER, and the labs are in there, little labs are in there. When I had to go to the ER, is just because I couldn't take the pains I was having.
Right.
But it seemed like headaches came with it too.
Right. And I know you have a history of migraines. We'll get into that. Okay. So would you say your joint pain and body pain has gotten much worse over the year by year?
Yes.
Okay.
Correct.
Have you made any associations with anything that triggers your hand pain, arm pain, joint pain, like foods you eat or lifestyle things?
Yes, that's why I changed a lot of I started looking up a lot of natural ways to get rid of inflammation. That's why I started maybe 4 or 5 years ago doing the natural local honeys, cinnamon, turmeric, in my foods and my teas.
Is apple cider vinegar?
Sometimes the apple cider vinegar.
Okay.
I mostly just natural.
Okay. Some natural foods.
Correct. Acupuncture.
Yeah.
I found that to really relieve a lot of my pain.
Nice.
She did the acupuncture. She would do the acupuncture and the cupping.
Okay.
I definitely felt some relief with that.
And how long would it last?
Not too long.
A day? More than a day?
No. Sometimes, usually that day I would be really tired, really tired, go home, lay down. The next day, just a little bit achy, but I'd say by the second day, all of a sudden it was like almost like a new person for a couple days.
Okay.
And then I'd start back, but then I was seeing her. When that would be going on, I would see her weekly when it was bad.
Yeah.
And then when I started feeling better, and of course I'd forget, and I'm better right now. So I'd go like a month or so, and
okay. So besides the acupuncture helping you, anything else you notice help you? I mean, we're talking about the pain, right? And pain would mean like muscle pain and joint pain.
I definitely know with eating certain foods, they have helped. One of my vices would have to be starch.
Starch.
Yeah, I would say that definitely a vice, like breads. I have a problem. I love breads. I used to love donuts.
Okay.
I do anything to try to stay away from those because I have noticed I do feel puffier.
Okay.
I do notice a difference. Same thing with certain meats. If I'm not getting like the non-GMOs or there's certain foods I'm starting to do now. We do organic.
So starch would really also be grains, right? Like, have you ever tried a gluten-free diet?
No, I have not.
Okay.
No.
What about dairy? You notice any issues with dairy? Because there's certain foods that really trigger autoimmunity. Gluten is a really popular one. It may not be the starch. It may really be the protein in the grains that's a trigger. With mixed connective tissue especially, it's a very, very strong relationship, okay? And then dairy is another one. Have you noticed anything with dairy?
I have not.
Do you consume dairy regularly?
I don't drink milk. I never have.
Okay.
But I do like cheese. I
Yeah.
love cheese. But I haven't seemed to see the connection. But if I do cheese with the bread,
Yeah, then you feel it.
rice is, because Hispanic do a lot of like rice and beans. We do a lot of definitely. I do a pot of beans every week.
Yeah.
Whether the Peruvians, the pinto, whatever, we try to do that because they are good for you and for the kids. The rice I've learned to, because it's so high in the starch, make sure it's rinsed off really good until the water's clear.
Yeah.
Try to get all of it that's only the organic. That's a big deal for us to try to switch everything to organic. We grew up that way for the most part. But a lot of times it was cheaper to buy easier to buy the other stuff, but now we've switched to organic.
Have you noticed anything with corn? It's a big part of your cultural diet.
I eat corn tortillas. We do corn tortillas. We've been making them lately also. No, flour.
So besides the starches, which might be really grains, anything else that's very noticeable for you or clearly noticeable for you?
Certain meats.
Certain meats?
Yeah.
Which meats?
I'd say pork if it's got a lot of fat in it.
Okay. What happens when you...
I can start feeling swollen, my hands puffy. I'd say probably within a couple hours. I know it's coming from what I'm eating.
Okay. And does it matter if it's fried or not fried? Have you noticed? Because there's different things that trigger the inflammatory response. Some of it could be like the pork protein itself, or sometimes it's just the fried part of pork creates something called glycosylated end products, and they cause inflammation. So have you noticed relationship if it's fried or not fried?
Interesting. I never thought about it.
No?
No, I thought what I thought for myself, maybe it's the quality of the meat we got.
Yeah.
Another thing, I don't do hot dogs. I don't eat bologna. I've never eaten anything like that. But I do eat every now and then hot wings.
Okay.
Those right away I notice I do right away start feeling swollen.
Yeah. Fried. Yeah. Okay.
It could be exactly that, the fried. I don't, so
yeah.
I try not to.
Okay.
But I do notice it's a problem.
Okay. So have you noticed any associations with like foods that are called nightshades, which would be things like eggplant or tomato, causing any greater joint pain for you?
I don't know.
Okay. If you don't know, that's fine. And then what about nuts or seeds? Anything you've noticed with nuts or seeds causing problems for you?
No. The only thing I was told a long time ago, years ago, was I had a diverticulitis. Mm-hmm. They said sometimes the nut and seeds can cause it to sit in a pouch.
Yeah.
But I still eat them.
Okay. Now, take me through like an average day of when you wake up and what you have for like breakfast, lunch, snacks. Starting with like, first of all, what time do you wake up?
On a
window of time, like 6 to 8, 7 to 9, or whatever.
No, I'd say 7 to 9.
7 to 9, okay. And then when you wake up, how do you feel? Do you feel rested? Do you feel recovered? Do you feel terrible?
Exhausted.
Exhausted, okay. Can you get out of bed, or is it really hard to get out of bed?
Sometimes.
Okay. Do you ever wake up and go, I feel great, I feel energized, I feel rested, I feel recovered?
Not very, no.
Not very much.
Maybe 5% of the time.
So 95% of the time you wake up and you don't have a normal response. Normal response is to feel, oh, that was great, I feel recovered.
Oh, it's amazing when I could say that. Like
okay.
it's amazing when I feel like that.
When was the last time
Goodness. Not since my heart attack, definitely.
How about before you started having joint pain and anytime?
Oh, I was great every day.
You were great every day?
I was great every day.
So before the birth of your first child, did you have any issues or not?
No, I didn't have to go to the doctor. I didn't do anything. The only issue I'd say I'd had was I'd had a bite. Something bit me on my back. I think I put that in there. That was the only thing that was weird for me.
Okay.
After from the twins delivery to my last son, I may have gone to the doctor a couple times.
Okay. So up until 31, like, things are great. And
Yes.
31 is really when the timeline changed and you started
Yes.
to go downhill from there.
Correct.
And the recent, heart attack
Correct.
is really where, like, you're peaking as far as health decline.
Yes.
Okay. Now, so you wake up 7 to 9. You don't wake up between 7 to 9. You're very exhausted. That's been going on for like 15 years now, right?
Correct.
And then what's the first meal you have? What time?
7 to 9. So my medications now, because I'm on medications.
Yeah, take your meds,
Yes, I try to get my meds done by 9:30.
Okay.
So because of it, I want to make sure I eat something. And I have a little grandbaby, so we usually do boiled egg or oatmeal.
Okay.
And fruit, whatever fruit's in season. So we usually have either the cuties, the little mandarins, pears, peaches, nectarine, blueberries.
And always bananas.
But always bananas. Whatever fruits, which fruits we have. Once a week, I do try, because I just love those acai bowls. I'll ask him to order me an acai bowl once a week for breakfast.
With granola?
Yes.
Okay.
Yeah, I love those.
Yeah.
And the baby does too, so.
Okay. So that's so you can have an acai bowl a couple times a week, but typically oatmeal, eggs, and some fruit.
Correct.
Okay.
And coffee.
I do have a coffee. That's where, actually my coffee is where I actually put a spoon of honey in there, and I put some sprinkle cinnamon in it. And a little bit of coconut oil.
Okay.
I used to do the turmeric in there. I don't like the taste, so I can't do it no more. So I have to do the tablets.
Okay. So that's the morning. And when's the next time you would have some
Lunch.
lunch? Okay. And so what time would that be?
Between 12 and 1:30.
12 and 1:30. Okay. So what's some typical things you would have for lunch?
Lately, because I started cardiac rehab, lately we will go and try to go and have lunch together. A typical lunch would be a sandwich.
Okay.
A sandwich, a salad, and iced tea.
Okay. Anything else? Typical meal, or that's kind of what you've been doing?
That's typically what typically even at home, we usually do some sort of sandwiches, or we'll go get the whole chicken at Albertsons with, the little tiny Hawaiian rolls, and make it just a mini sandwich.
Okay. All right.
And Caesar salad or whatever salads are in season. For dinner, that is a little bit different.
Okay. Between 12 and 1:30 and before you get to dinner, do you have any snacks?
Yes.
What do you have? Let's go there first.
Whatever fruits there that we have out, and nuts.
Fruits and nuts. Okay.
Because we usually have quite a bit of nuts. We have pistachios. We have almonds. We have a variety of different nuts now.
Okay.
Right now we have a lot of peanuts.
Okay.
We do have peanuts right now.
Okay. And then what's dinner for you?
Dinner is different. So dinner, typically Monday through Thursday, we cook.
Okay.
Whether it's myself or the kids. I don't cook as much just because I'm usually too weak or don't feel well. But a typical would be the majority of it, 80% of it, are probably Hispanic foods.
Okay.
Where either, like I said, we do rice and beans.
Okay.
Avocado. We do a lot of guacamole.
Okay.
Almost every day we do avocado.
Okay.
And
Tacos.
we either do
use flour tacos or corn?
No, corn.
Corn, okay.
corn, and we usually do the two options. One where it is fried, but we do grapeseed oil, olive oil,
Okay.
or
Avocado.
avocado oil. Those
So
are the three
basically,
oils.
Mexican food Monday through Thursday that you make yourself at home.
Correct.
Yeah.
Okay.
We make it at home.
Make it home. Okay.
Yes.
And then you will have like flour tortillas and
She doesn't eat flour.
no burrito or anything like
I
that.
try to stay away from
Just
it.
corn.
Yeah.
Okay.
It's a prop. I love flour tortillas or any. So I know I do my hardest to stay away. We don't buy it.
And is it because of the symptoms it causes you, or you just worried about the starch, or what?
I'm worried about the starch. I just hear it's not good for you, and
Okay.
it's probably why I like it so much.
Okay.
So I try. I'm like, you know what? Let's just not go down that path. So let's do corn. I'm perfectly fine.
Okay.
Yeah.
And so what happens Friday through Sunday?
Friday we usually order out.
Okay.
Typically it's either going to be flamin' skewers.
It's a Mediterranean place.
Okay.
Yeah.
You get pita with that, or
No,
No.
I don't do
And
pita.
she does the bowl, so it's a shawarma, rice, lentils, and salad in the bowl.
Yeah.
all right.
Yeah, so there's
What else?
Pretty
What else? Some other things?
It's Chinese.
Chinese food.
yeah.
Would be another one. I get the chicken
The-
spicy chicken cashew, or what
Kung
is it?
Pao chicken.
Kung Pao
Kung
chicken
Pao.
Okay.
is the one I do with the noodles.
Okay.
No rice.
Okay.
Those are usually our two dinner options that we order out.
Okay. And then anything after dinner?
Yes, only on Friday or Saturday we usually do ice cream, some sort of ice cream.
Or pop.
Oh yeah, or popcorn. So Dewar's ice cream,
Okay.
or we'll do popcorn that he makes at home.
Okay. All right.
And the ice cream, she doesn't eat the whole thing. It takes her like 3 or 4 days to eat, you know, what
One
I would
order.
call normal.
Okay. So.
I don't have a sweet tooth.
Okay. So. Just to kind of give you some perspective, you know, when it comes to, like, when I read your case history and case review and I see what's happening, like, I look at your imaging of your spine, and it's either an NFL player that has been in a lot of trauma, or you have an inflammatory joint disease. You have an inflammatory joint disease that way, right? Like, something's causing that constant inflammation for you. And then when you look at your recent heart attack and you have dissection of the artery, that happens with mixed connective tissue diseases that can be secondary to autoimmunity. So when I was reading your file, to me it was like, okay, you know, Christine's got a lot of autoimmune stuff happening, probably happened years ago. It seems like now, like after the birth of your child is really when it started to really turn on. That's really common. A lot of people have their autoimmune diseases turn on after pregnancy. There's usually a genes there, and at some point something turns them on. For some people it could be trauma, like they get in a real bad car accident, their autoimmune turns up. Someone could be psychological stress that really turns it on. For other people, it could be pregnancy. So at some point, something will trigger those genes to turn on, and autoimmunity starts to develop. Okay? So it seems like you've been going through this autoimmune process for 15 years. Now, when it comes to autoimmunity and trying to manage it with diet, nutrition, lifestyle, it's not about the calories, it's not about how much, like if you finish the ice cream or not, it's about the protein. So certain proteins trigger the autoimmune response. And even trace amounts of the protein can trigger the autoimmune response. Okay? Like, you're pretty much eating gluten almost every meal, or at least for sure every day, which is 100% a trigger for connective tissue disease. Okay, so is milk. So we can test these things, but I would tell you, with full honesty and directness, you have zero chance of changing your inflammation unless you drastically change your diet. And the problem with this scenario is, like, you kind of have it as a family household thing. Where you do ice cream together and do Chinese food together and do all that. And now, if you really need to follow the guidelines, it's going to be completely turnaround. This can make or break your recovery.
I think everyone at home would be willing to switch to whatever lifestyle eating is needed.
Okay. Well, that makes it a lot easier. You on board?
He may be the hardest one. He would be the hardest one. But as far as home, that's all they want. They started growing vegetables and started a garden.
Right. So the frustrating thing is, like, you don't know what to do, right? Like,
Correct.
oh,
I don't know anything about this. I know nobody with autoimmune.
Right.
I have 10 siblings. I know nothing.
They probably have it, they just haven't been diagnosed.
Correct. They don't go to the doctors either. They refuse.
Right. But this is the problem, is like your autoimmune expression ended up causing you a dissecting artery more than likely than anything else. So sometimes autoimmunity will pop up its face, and then that's when it finally gets diagnosed. Just like it happened with you, right? You didn't get the autoimmune diagnosed until you went through this cardiovascular recent
Correct.
event.
Correct.
Okay?
It's just now happened. I never even heard of mixed connective tissue.
Yeah.
I just went last week to the appointment. Everything you're telling me is exactly what they just recently told me, except that how to prevent it, or how to what to do to help.
Right.
For my, what can I do other than just medications?
Right.
And I would, that's what I've been wanting to do. I'm willing to do whatever needs to be done.
No, I understand.
But even with the mixed connective tissue, I had no idea. She started checking to see if I have, what do you call that? Double jointed.
Right.
For whatever reason, that has to do with the tissue.
Some people have ligament laxity. You don't have to have it, but anyways. So I think it's really, from a person that works a lot with autoimmune patients suffering from autoimmune disease, like this is either going to take you down, okay, meaning you're going to get another cardiovascular event, you're going to get a stroke, you're going to end up with autoimmune diseases progressing, because when you look at your labs, you actually antibodies to your RNA, or basically to your DNA, and people have, this is called a systemic autoimmune disease. It's more than just your connective tissue. It's your blood vessels, it can even be your organs. Like, this is your major risk factor for how you age the next 30 to 40 years and what kind of events happen to you. So it's like really serious, right? And the hardest part of this is when you're trying to figure out like what to do about it. Is you look at dietary triggers, you look at chemical triggers, you look at environmental triggers, you look at lifestyle triggers, and you try to remove those so the inflammation, the autoimmunity comes down. So diet is usually the hardest part for most people, right? Because it's a complete lifestyle change, and it impacts not only you, it'll impact Ben, it'll impact your kids, it'll impact everything, and then that social relationship with food and family and friends getting together can all of a sudden change, but like that's the level you have to take it to make a difference. And the typical place to start would be what's called an autoimmune diet, right? An autoimmune diet is basically no grains, actually, no gluten. So like right away, I mean, I'm looking at your diet and going, oh my God, like everything you eat is going to be a problem here. Because you're eating corn tortillas, you're eating rice, you're eating sandwiches with regular bread, you're eating oatmeal.
And I don't know what gluten is, so yeah. I guess if I don't know, I think I can eat whatever.
Right.
But
you need direction. And I'm just telling you, like this is in a real world, instead of just theory. This is not easy, because now you have the social dynamics, the family dynamics that are involved. So, but you've also had a serious life-threatening situation that kind of, it's not just like I have joint pain.
No, it's a wake-up call. So I'm
right, and this is what I want you to understand too. It's like if the autoimmunity progresses, it's not just your joints and pain you're feeling that's causing the problem. I mean, it could be your blood vessels that are being injured, right? And that's where things get scary. So you have to really jump on board with this stuff, okay?
Okay.
Now with these food proteins, we can test specific foods. We can distinguish whether you actually have celiac disease or not have celiac disease.
Okay.
Fortunately, they don't do this in the conventional model, and it's not part of like insurance model testing, because they don't really address diet, nutrition, lifestyle. I mean, you basically have gotten as good as medical care anyone would get. You've had really good care at UCLA, and things like that with your involvement, very good. There's nothing to criticize there. It's just the model itself doesn't look at diet, nutrition, lifestyle, right? It's not like your doctors have done anything wrong. It's just not their training, it's not their area of focus, and it's not part of a hospital procedure, it's not a part of insurance testing, and that's why you kind of have this void and not knowing what to do, right? And so what we'll do is before we get done, we'll make a list of like potential labs and everything that we might want to investigate things further. Okay. So one option is have you heard of celiac disease?
I've heard of it, but don't know anything about it.
So right now you have mixed connective tissue disease as a diagnosis.
Yes.
Okay? Lupus is a diagnosis. And usually when you have one autoimmune diagnosis, you have others. And the way they diagnose an autoimmune disease is which target protein is being attacked. What your immune system is attacking, right?
Okay.
So with lupus, anytime you start to test for the immune system attacking your own DNA, right? RNA,
Yes.
that's called like a systemic autoimmunity because you have those proteins in every tissue in your body. And that's called a systemic autoimmune disease. And if someone has just antibodies, for example, just against their thyroid gland, they call it like Hashimoto's, right?
Oh.
So you can have like an organ specific or you can have systemic. So you have systemic autoimmune disease because the immune system is attacking your RNA proteins, right? Your DNA proteins. And that's what lupus is. That's what distinguishes lupus from other autoimmune diseases.
That's why I was told it can go after anything, not just one.
Right. So this is why, like, it's really important to calm this down and to figure out things that trigger it, right? So ultimately, when we look at the lifestyle game, what lifestyle factors trigger your immune response? Because if they trigger your immune response, they're going to trigger your autoimmunity. It's hand in hand.
Okay.
So, for example, if you are significantly sensitive to gluten, you keep eating it, you're triggering inflammation against whatever your immune system is making antibodies against. Right now, we know for sure it's DNA and RNA. You haven't had other proteins tested. We can check out the proteins and see if you have autoimmune. Like you have a lot of brain symptoms. Like your brain's not functioning well. Focus, attention, concentration, memory, recall. They're all not good for your age, right? So it's like you may have autoantibodies against your brain. You could have autoantibodies against any organ system or tissue. So as it comes to like testing and what kind of things we want to check, we can make a list of things to evaluate. You don't have to do them all at once. And some of them may not be as important. Some of the testing could be like, now I understand this more, but it's not changing your treatment. Okay. Now, some people have what's called celiac disease when they have lupus or autoimmunity, which is its own autoimmune disease, which is gluten itself causes intestinal autoimmunity.
Oh.
Okay, but for most people, even if they don't have celiac disease, gluten itself is so inflammatory that it triggers their autoimmunity. It's just how severe gluten is. So when we get down to making a list of lab tests, we can kind of figure out whether we want to really dig into that or we just want to jump into the diet. You're gonna have to jump into the diet.
Okay. Yeah. Okay. No, that's fine.
Okay.
I can do that.
And I'll give you some information about the diet, but it's pretty much going to be what's called autoimmune paleo.
Okay.
Autoimmune paleo is basically paleo kind of means like you eat like a caveman, right? Like,
Okay.
nothing processed, nothing new, right?
Okay.
Which you're close to because you're eating a lot of natural foods and things. But it's going to be the tough part for you, like looking at your dietary history and how things work, is going to be the grains, the rice, the corn,
Yes.
the gluten, the
Yeah.
cheese. Will be
Okay.
the main ones. And then they also have you avoid what are called lectins and nightshades. So those are like nuts and eggplants and things like that. So then you're like, what do I have left to eat? Is
Wow.
the typical question, right? Like,
Right. The thing you thought they were good for you may
Yeah.
not be.
may not be. So certain proteins are very stimulating to the immune system. Like proteins that are found in seeds have what's called lectins, and lectins seem to be very immune stimulating. And that's why they're different than if you have an autoimmune disease, right? So when you have an autoimmune disease, there's a sensitivity to certain food proteins that for some people are actually very healthy, right? Like most people would great with seeds, lots of healthy
Right,
fats, lots
right.
of nutrients. But when you have autoimmunity, you're not really looking at the nutrition content of the food. You're looking at the protein and how it triggering is to the immune system. It's a difference in shift. And even trace levels of exposure, like if you have peanuts just occasionally, that could be enough to keep you inflamed.
Oh.
So you're basically going to be on like on autoimmune paleo diet. Meats are all okay, and vegetables are all okay. So basically you're eating lots of meats and vegetables. Fruits are okay. There'll be a few vegetables and fruits that are nightshades that have like seeds in them, like tomatoes, eggplants, that you wouldn't have to remove.
Okay.
But that would be something to try. And the most important thing is you don't want to do lots of things when you try to find dietary lifestyle approaches to turning your autoimmunity around all at once, because then you don't get to see the impact of it,
Okay.
right? So we did 5 things tomorrow. You maybe felt better. We don't know which of those 5 things are. So with cases like yours, it's always best to just go, all right, let's just do the dietary change first.
Okay.
See what smoke gets cleared out of the way.
Oh boy.
And then kind of dig from there.
I can do it. I know I can do it.
Yeah. And
It'll
the
be
thing
good for you too.
The thing too is, so when you first do it, it's actually also diagnostic, meaning that how you respond tells you how much of an impact these foods are having on your health and function, right? Because like the genes are turned on, they're ready. Your immune system's overreacting, and every time it overreacts, it's going to attack your tissue. That's where you're at. So that's happening baseline, and no one has found a cure for autoimmune disease, and it's not. No one's close to finding a cure for autoimmune disease. Researchers all over the world are investigating how to do it, but it's very complex, right? But you're at the point where your immune system is overactivated, and every time it gets triggered, it's going to attack any tissue that has RNA in it. And it's gone after your vascular tissue to the point you've ended up in the hospital with a heart attack. It could be impacting other tissues. We can test to see what other tissues are being impacted. I mean, I highly suspect you have some neurological antibodies because of the degree of brain symptoms you have. And then once you know that, like that's your baseline, if you can find daily things that are triggering it and you remove them, you should calm everything down. And when you go on a strict autoimmune paleo diet for, let's say, let's do a 1 month window.
Okay.
Where you see how it impacts your health. Okay, you will feel a difference or not feel a difference. You should feel a difference. But this is why it's so important to be 100% strict during that month. Because it's not only therapy, but it's diagnostic.
Okay.
Okay. Now, we can't test you for foods you're sensitive to. But if you haven't been eating those foods for about 2 months, then you can get antibody tests against the food, which tells you if you're sensitive to the food or not, that are not accurate. So we can assume you're just going to be an autoimmune paleo diet. There's no question your autoimmunity is there. You have autoimmunity.
Yeah.
You've had pretty extensive testing. It's clear that's there. Okay, but as far as foods go, you more than likely will probably want to stay on an autoimmune paleo diet forever.
Okay.
But if you want to see which foods your immune system is really reacting to now, that's when we would do a food sensitivity profile, where we check like 200 foods and see where you're showing the highest antibodies against.
Okay.
Because there could be some foods on there that are apparently healthy, but you're still reacting against them.
Right, because it may be healthy for others, but not for me, my body.
Yeah, you could be reacting to every food to some degree, and then we have to still put you on an autoimmune paleo diet, and then have your immune system calm down, and then we can do a follow-up test and like realize if your immune system is calming down because you're not showing up to every food, you're showing up to some foods.
And do you think by getting my inflammation and everything, let's say I'm able to get the diet and it's able to drop my immune system, do you think eventually it'll help me be able to get off of medications that I'm taking for autoimmune?
Well, most of the autoimmune medication you're taking is because you're having pain, right?
Correct.
Yeah. So you're gonna have to kind of see how it works with that.
That's why they're adding that.
Right. So it's not within my scope of practice to do anything with your medication. You're gonna have to talk with your prescribing physician about that. But if you're not in pain, you're probably not going to feel like you need to take that.
Okay.
And the best scenario is you make some changes, your inflammation goes down, so you feel like you don't have to take these medications for pain. And then now you don't have all these additional medications impacting your immune function and so forth, right? Because even though they do studies with these medications that are very well done, like clinical trials that show that the drugs work and they get approved by the FDA, they never really study the effects of all these drugs together, right? What they call polypharmacy. So no one knows, like, well, you're taking this combination, and what does this do over 10 years and 20 years? Like, that doesn't get done. So that's one of the drawbacks of it. So if you can manage your pain and inflammation and the things that are causing you discomfort with just lifestyle, then that would be the best scenario. Now, the pain you're feeling in your connective tissue, like if you see, the thing is, you have autoimmunity where it's also impacting your joints, right? And your spine and everything. So you can feel when your autoimmune disease flares up. But some people have, let's say, autoimmunity just to their blood vessels. There's no pain fibers in the inner lining, or just to the brain. There's no pain fibers in the brain. So they flare up and they don't know they had a flare up. So having this like joint pain is like a little signal telling you you're inflamed and your immune system is being activated, right?
Okay.
Because you have systemic joint pain. All your joints are hurting. It's not just like a bad knee you injured playing soccer 30 years ago that keeps acting up. It's your whole body. Anyways, so we'll probably start with food. We can test some foods and see where they are.
Okay.
The most important thing will be that first month to be 100% strict.
Okay.
Because then if you're not, like you still have nuts or you still have a sandwich or a piece of bread here and there, then it's still going to trigger your immune response. And it's not it doesn't work like, well, I just had just a small cookie or something. Like it's like domino effect. It's not the quantity, it's just the fact that protein gets in there and that triggers your immune response like a domino effect. So you just need a little bit of trace exposure to continually be inflamed. So it's not like, well, I cut it down. It doesn't work. It just has to be completely eliminated. Does that make sense?
Yeah, so instead of, if you still want the sandwich effect without the bread, just do a wrap.
Do a wrap.
Perfect.
Yeah.
Okay.
So with autoimmune paleo, there's like lots of online forums. There's lots of books, recipe guides.
Okay.
People use crock pots all the time to like slow cookers to just plan meals.
Okay,
There's lots of things you do, but it's just like there's that transition of time. And it may take you like a week or so to transition in there. Now, what makes people fail and have issues is like they don't have the right snacks in their home when they turn into autoimmune paleo. They get hungry. They just,
What's there?
what's there, right? And you have a very close family, and you have the social thing that's there, so you have to make those adjustments too. And you should know there's a very strong likeliness that your kids are going to end up with autoimmunity because it does pass. And I know, Ben, your family tree has RA in it.
Yes.
Yeah. So 2 parents both with autoimmunity is setting up risk for both your kids. Both parents are having the genes. So, I mean, if your family can slowly transition to an autoimmune paleo lifestyle with less inflammatory protein foods, the better, right?
Correct.
So in our family, like our family, we don't eat gluten or dairy, and our daughter's been gluten dairy free her whole life, right? So she has gluten-free options, right? And as a kid growing up, she's 16, but as a kid growing up, she's just, hey, there's been times where people have brought in cupcakes to school or done other things, and I wasn't able to have them. Like, get used to it. That's the way it is. And then she gets used to it, and then kids are resiliency, and you can, just be aware of that. Since, like, I know my wife, Andrea, like, she'll go in and bring in gluten-free snacks when there's sometimes having a birthday party or things like that. But just be aware that it's not just you. and Ben, with your family tree, like, you may have an autoimmune disease turn on if it's not there already.
Your mom has lupus.
She has lupus and RA and something. Yeah. There's a lot going on with us too.
Right. So an autoimmune disease, just so you know, are now more common than cardiovascular disease and cancer combined together. And it's really, now some statistics are showing it's like 1 out of 12 women
oh my goodness,
have an autoimmune disease, and 1 out of 25 men have an autoimmune disease. And it just ends up causing chronic inflammation and pain, and then it shows its heads up, like when you have a heart attack, because the cerebrovascular system, where it shows its head, where someone all of a sudden ends up with, can't walk, and they have MS, and it's like, it's not overnight. It's the autoimmune disease was there destroying the tissue, right? Like, you don't just get a dissecting artery overnight. That's long-term inflammation that injures your artery. Right?
Yeah, and I was just advised for my family and the kids to get tested for autoimmune. So
Right.
They did advise that they go
Right.
get tested,
So
because if you can prevent something
Right.
at a younger age, or
Get ahead of it.
hopefully they won't be in my situation.
Right, but and in their world of prevention, it's just basically early testing, and then, okay, you have it. But
But then what?
real prevention will be diet and looking at to see what your immune system is actually reacting to, like specific foods and triggers that way.
I think that's a lot that's been difficult because you're told. So I got the phone call
Yeah.
in November. Okay, so you've got this. I don't even know what it is. What are you talking? What? Like what?
Yeah.
Didn't know. There was no heads. I guess heads up. I was always told allergies. It's where we live. Everybody has it. Here's a shot. Or
Yeah.
But there was no. You know what? Try to find a better way to eat.
Yeah.
It was here. We're going to give you medications. You'll be on them for the rest of your life.
Yeah. And it's just, and again, it's not because of bad intentions. It's just there's different. They can't do everything, right? Like you can only do so much. And the preventive medicine part of autoimmunity is its own field and its own specialty. It's just not part of standard hospital and insurance models yet at this point.
Yeah.
So that's why people don't know what to do, even though they're getting great care. Like you've gotten great care, you just haven't had that part of it addressed. So I guess the big picture is, it's not just like you're not the only person with autoimmunity here. Your whole family really has risk, right? And it just wouldn't make sense. Like you make corn tortillas or sandwich for everyone else,
the same stuff,
right? And then you find foods you actually all like that within those restrictions. And then you want to keep the social part of this and not impact that in an unhealthy way, right?
Okay, which I'm sure everyone would be on board.
I'm sure everyone's on board.
Our oldest one, he says we eat horrible anyway. He's literally gone into our pantry and thrown it all away multiple times because he says we don't eat. We need to only eat healthy foods, no preservatives, no.
Yeah. When are they going to test your children?
I just let them. know. So they're just trying to figure it out.
You should definitely do that.
Basically, I probably have to schedule it for them.
So let's go for it. Yeah, like you're already dealing with a lot of stuff on your own.
but yeah, probably. I get a feeling one of the twins is. She's always sick. She's exactly the way I used to be when I was her age.
Okay.
She gets sick longer than anyone else. She's constantly got these headaches and doesn't feel well and affects her work quite a bit. And other times she's perfectly fine.
Yeah.
So I get the feeling.
And there could be many triggers, but let's say it's not uncommon for food to be a trigger, and she ate a couple of foods that triggered her, and that's why she's feeling bad for a few days, and she didn't.
It makes sense. That makes sense.
It's common for autoimmunity. Now, so food is one part. So basically for food, when we get done here, because I want to know exactly all the things I'd like to like. What I'm going to say it differently. Once we get through this part of the history and then get your physical exam, we might have new things that pop up in your exam, like, oh, we should test for this.
Yeah.
But when we get done, we'll make a list of tests to do. So foods would be one of them, and that's the main trigger.
Okay.
And it seems like you got the mindset to do what you need to do. Yeah. And you just need some direction. The other triggers that happen with autoimmunity are going to be chemicals.
Okay.
So chemicals can trigger autoimmune responses. By chemicals, they're chemicals that stay in your body forever, and they're chemicals that you get exposed to and your body can clear them. Like pesticides, you get exposed to BPA, like in plastic products, you get exposed to like benzene from cigarette smoke, you can get exposed to. So these are like chemicals that can trigger autoimmunity for some people. And we can check that with looking at antibodies to certain chemicals. And seeing, like, you might be very sensitive to cigarette smoke that you may not even know about, and that could be triggering autoimmunity. You could be very sensitive to like BPA in plastics. That could be triggering autoimmunity, you don't even know it. So there's a point where labs can be helpful because it helps us understand what are things that aren't obvious that could be triggering your immune response. And then when you do blood work, they basically take your blood and they look to see where your immune system is making antibodies against, like for what things. So if you can make antibodies against plastics or benzene, that means that's a trigger for your immune system, right? So it makes it, and what we do is called functional medicine, so it's like a personalized model, meaning you could have 10 other people with the exact same lupus antibodies you have, but they would have different triggers. Everyone's unique. That's one of the hard things about autoimmunity, is individualized. And your children may not have the same chemical sensitivity as you do. You may be very sensitive to cigarette smoke and benzenes and car exhaust fumes, right? Because they're all benzene, but someone else in your family may not. Or someone else with the same autoimmune disease may not. So So we'll talk about food proteins. testing, and then chemical testing. That's another one. Another one is to look at testing for where the other autoimmune reactions may be taking place. So we can test like all the main tissues with one blood test. We can see if you have antibodies besides your joints to different organs, see if you have antibodies against your brain, see if you have antibodies against your pancreas.
Okay.
And that will help us know if it continues, like let's say you have antibodies against your pancreas, oh, you could end up being diabetic. If you have your autoimmune response and not even know it.
Okay.
Right?
Yeah, yes.
So that's another form of testing. And then there's lifestyle triggers for autoimmunity. And lifestyle triggers, so let's talk about a couple of things here. You seem to have a lot of great things that you're doing. So you're doing yoga, meditation, playing with crafting and all the other things. That's really good. How often do you do yoga and meditation?
I can't. The meditation. We've been back trying to do it every night now.
What kind of meditation are you doing?
A lot of it is the videos. The chakra.
Oh, okay, chakra meditation.
Yeah,
okay.
the chakra medications.
Okay.
A lot of it I put on the 432 hertz or the,
Okay.
and a lot of it try to relax at night. I have such a hard time sleeping.
Yeah.
We both do. So the meditation we're trying to do at night, you do it a lot throughout the day also.
Great.
That really helps. I used to do yoga quite a bit. My daughters actually even they're yoga instructors.
Okay.
But with this whole lupus, it's very difficult for me to be able to do a lot. I think what's one of my biggest problems, I bought so much stuff to try to, even because of COVID, what I could do to keep myself busy and doing things. That's where the crafting started coming in, and I bought so much stuff. I can't get the energy to do anything.
Okay.
It's so, but the hobby became the shopping, not the doing, and it's so frustrating to me.
So there's two things that are really critical for you to get healthy. One is to calm down your autoimmunity, and the other one is to get your blood vessels healthy. And both those require movement, like some type of exercise. And obviously when your joints hurt and your body hurts and you have no energy, it's not easy to do, right? So it's not something to, let's say, jump into tomorrow, because I think once you take away these dietary protein triggers, I think your inflammation is going to come down dramatically. As your inflammation comes down, your body won't
Hurt
as much, and then your energy will also go up and your inflammation goes down. Okay, because inflammation impacts your energy producing mechanisms, right? So, even when they've done studies with people that have really progressed rheumatoid arthritis, where their joints are degenerated and hurt, they find that even if they have them exercise, their joint pain, their inflammation, their autoimmunity calms down.
Okay.
So, the most easy way to do it is actually like exercise in a pool when you have lots of joint pain.
Okay.
Have you ever done any kind of pool aerobics or swimming or anything like that?
I don't know how to swim. But
Perfect.
It's low impact.
No.
It's just resistant.
And they have exercise routines where you just go in a pool deep enough where you stand, so you don't know how to swim. You don't know how to stand. And then you just do calisthenics in the pool, and it takes the pressure off the joints.
Okay.
And then actually being in colder water, it actually triggers mechanism for everything.
I've heard of that. People tell me all the time. So yeah, I'd be.
So at some point, like, we have to get you to move, because when you move, your blood vessels actually release growth factors that help your arteries heal.
What has helped me move? I've been very fortunate with the baby. She's 2.
Yeah.
She goes in the room even when I'm in bed, and to go and get me.
Yeah.
I'm forced to get up because it's that smile.
Yeah. Yeah.
Gives me, as drained as I am, as tired. Luckily, a lot of my movement is with her, and even though they restricted my weight limit, a lot of it is just going with her. She likes to dance to her Frozen or her little songs
Or
and
Selena.
stuff. So she wants, or Selena, she wants me to dance with her and move with her. So I've been fortunate enough to be able to have that motivation to do it. I have to keep sitting down or laying,
Yeah.
but she motivates me to makes me move.
Good.
So
But we want more.
yeah, yes.
So, so you want to look at like pool, like
Okay.
aerobics or something like that. Do you know? of any of these places?
Yeah, there's one.
The gym next to that, the one you're going.
No, not the one at the house. The one by on Coffee.
Okay, yeah, that one's got
They
the
have a
pool.
pool.
So what's going to happen when you do that? So let's say, so things are going to go in like steps, okay? So the first thing will be the dietary stuff, which is going to be, it's going to take you a week, 2 weeks to figure that all out, get your snacks organized, and then like another good month to really start to get the hang of it, right? And then from there you'll just start to get better and better finding foods you really like to eat and as a family and doing all that, right? So
Okay,
that's like,
yeah.
but once your pain and inflammation go down, let's say a month into that, the next level you need to get your cardiovascular system healthy to repair your arteries is you got to get movement.
Okay.
So when you exercise and move, well, first of all, I'll explain a couple of key concepts to you. So blood vessels are actually classified as part of the endocrine system now. They used to think they were just pipes, they just carry blood. But what they find is that your blood vessels actually produce hormones and they produce growth factors. And that's why they got relabeled as an endocrine gland. And your blood vessels release things like something called vascular growth factor and something called nitric oxide. They're just these chemicals. But what they found is they actually heal the injury that happens to blood vessels. They get rid of plaquing. And they actually have this very powerful protective role. Okay? And the only way they get activated is if your heart rate goes up and circulation against the arteries activates these release of these hormones. So if you totally shut that down and not have enough that system activated, you're going to have a really hard time healing your blood vessels.
Okay.
Because you have to calm down the inflammation that could be destroying them, but at the same time you got to activate things that help them heal. Okay? So that's where getting in the pool and doing all that will help. But also what they find is that when you exercise, it activates what are called regulatory T cells, which calm down autoimmunity. So you'll notice that like if you can get in the pool, let's say 3 days a week, like let's say Monday, Wednesday, Friday or something like that, your overall joint pain, overall inflammation is going to dramatically go down. And then maybe something happens and you can't get to the gym, like or whatever, you're going to notice all your pain and everything go back up. So you're going to see a direct relationship with it. But what I want you to understand is every time you're having joint pain and joint inflammation, you're also probably getting vascular tissue destruction. Right?
Okay.
So as long as your joints and your body are hurting, you're probably having immune inflammation reactions against your arteries. And that's where it gets scary.
Yeah.
Right? And the more days you're less pain, less free, then the less injury you're having to those tissues. And the days you actually do get to exercise and move, you're actually releasing growth factors and hormones in your blood vessels that can actually heal your artery.
So that's why it's important to take care of it now.
Well, you got to get into a routine. Like this is all about getting into a routine and then being as consistent as you can with your routine. Like when we look at this from dietary and lifestyle, like you don't have this because you're deficient of a nutrient and you need to take it and all of a sudden you're better. You have to like shift the expression of your body into a recovery, anti-inflammatory state and then stay consistent with that to then stay healthy and not have this autoimmunity, express itself with you. So that's going to be like the first big thing will be to get your diet down to get your inflammation. The second thing is as soon as you feel up to it, we're going to get you into a pool.
Okay.
Yeah. Another thing that can work with you with a lot of joint pain is a bike.
Okay.
Do you like riding a bike?
We
You
have
can do a
one.
stationary bike.
I don't know how to ride a bike.
Have you seen those Peloton?
Yes.
Like those would be great because you can just turn on a video and jump into a class and it's not going to impact your joints
Okay.
because you're just pedaling. Like you buy a bike and then you have like a subscription and then you can do that. But that can be very helpful as a way to not have to sometimes it's too hard to get to the pool and change and do all that. But you can quickly jump on a bike and turn on a 30-minute workout and get that to be part of your routine.
Okay.
So for people that have like joint inflammation, joint pain, pools or stationary bikes are really the main types of low impact therapy. Because we
Okay.
can't have you like run. It's gonna inflame all your joints.
Right. I did that stress echo last week.
Yeah,
I wasn't able to finish.
because of the pain.
The breathing, sometimes I get this labored breathing or just really hard to breathe.
Yeah.
And just can't catch my breath quick enough.
Yeah. Well, we'll do some testing for your lungs today and check how that's going. But a lot of times you just have a lot of mucus,
Okay.
especially if
Oh,
you're really inflamed.
and a lot with how you eat, right?
Yeah. It may not just be foods, remember, it could be chemicals and other things you're
Okay.
in the environment too. When you thought of me, you have foods, you have chemicals, you have lifestyle factors. The other one could be like infections or pathogens. That's not the thing we need to dig into right now because you don't have a history that shows a lot of that that's taking place. Your white blood cells were on the high end though. Did you see that on your lab test? They were like 11, 11, 11. So we'll keep an eye on that. But at some point, those are the 4 areas that we have to help you figure out, which is going to be like dietary triggers, chemical triggers, lifestyle triggers, and then any kind of underlying infections or
Okay.
pathogens that could be. And then those are the things that will dictate how aggressive your autoimmunity is going to play out for you, or if you can get into remission. So you can't cure autoimmunity, but you can put into remission where it's not really expressing itself. And for everyone, once they can figure out how to get into remission, let's say you change your diet, you start to change your lifestyle into the point where your immune system is responding to that really well. Okay, and there could be various things over time we'll figure out, and you'll figure out as you go through the process. But then you get in remission, maybe like, oh my, you have some drugs, but it's minimal, right? Or you may not have any at all. That's those are all possible. There's still going to be some bad days. Like you could have some things really flare them up. You could end up being stressed out over something at work, and that causes you to not sleep well, and that makes your immune system flare up like crazy. And we got to see why you don't feel recovered after your. How many hours of sleep are you getting?
I am now getting, I'd say I do get 7 to 8 hours of sleep now.
So you're getting a normal amount of sleep,
Yes,
you're just
I
not
am.
feeling recovered.
Correct. I do believe I am getting sleep now, where before the heart attack it was just,
Okay.
I'd be going to bed, like fall asleep like at close to 2 in the morning, be up at 6,
Okay.
just couldn't sleep. Now I feel like I am getting sleep, but
Yeah.
I'm not feeling,
Rested. Yeah.
Yep. Okay. Well, those are things we have to kind of dig out. Like I said, we want to start with diet and get the inflammation down, and then kind of see what's still left over. Because it could be because you could basically have your dietary changes impact your inflammation so much that also impacts your sleep. You feel totally rested and recovered. Or on the other hand, if it doesn't, then we got to figure out, okay, what's still there? What's causing that issue with you? So sleep is another key thing for autoimmunity. Like you have to have proper sleep and recovery and sleep to be able to not have the autoimmunity express as much.
I think the difficult part, I think the reason I'm not feeling rested is ever since I've been home, I keep getting almost like these cough spells only at night while I'm asleep.
Right.
And I think I put it in there only while I'm asleep, and I wake up from it almost like someone had put a pillow over my head, face or whatever. Need to catch my breath. But then I get up, sit up and stuff, I'm fine. I'm perfectly fine.
So that's most likely a post-nasal drip causing you
Okay.
to cough. So you're probably sensitive to something in your room, most likely dust.
That could be it. Even though you change the stuff, you might be right.
Do you have a filter?
I change them. Yeah.
What kind of filter do you have?
I have no idea.
Are there HIPAA filters?
There's regular air ones.
But
We
it
have the
does
home
hit
one.
us.
Yeah.
No,
We
you
don't-
might need a special filter that actually gets rid of dust particles.
Like that.
In
Well, we
Costco,
have-
we
yeah.
can grab one.
It has to be
see.
HIPAA, HEPA.
Yeah.
So first of all, one of the main reasons people have just like this weird random cough, not having like a lung infection, lung disease,
Correct.
is they get post-nasal drip. Okay, so they get all this nasal congestion and mucus, and then it drips into the back of their throat and causes them to reflexively cough. Okay,
That may be it. And I'm laying down.
and
it's
the
when I'm
biggest indication
sleeping.
is head position. So people that actually have post-nasal drip that have sometimes sleep in pillows that are elevated, it really doesn't work that well. But for some people, it reduces the symptoms. But the key thing is if you get upright and it goes away and it's improved, it's most likely for sure post-nasal drip. Most common cause of that in the bedroom is going to be dust. So
Oh, that'd be great.
so
That'd be an easy
so maybe
fix.
we'll add that into the protocol too.
That would
We'll have
be
you get a HIPAA filter.
Okay.
Costco room.
Yeah.
So make sure it's HEPA, HIPAA
Yeah.
filter, because that actually gets
Changes,
enough
yeah.
small particles.
That makes sense. Okay.
And
That's
then-
like the one. Chris
And then what we
Yeah.
want to see if that impacts your sleep, like you feel recovered,
Okay.
right? And also see what your diet does with your sleep. But if we can get to the point where you're sleeping and feel recovered, your inflammation's down and you're doing exercise to the point where you're protecting your blood vessels, you're getting movement, you're getting activity, it's coming down autoimmunity, you're completely changing the trajectory of your autoimmune disease from like getting worse and worse to getting stable and eventually even going to remission.
That would be amazing. That would be like my complete goal. The outcome is to get that in remission. It just
Yeah, it really is it should be your number one goal in life right now. Because if you don't, and with you, the scary thing is that it's expressed itself in your cardiovascular system, which can be life-threatening.
right. They keep
joke.
telling me that I was very fortunate.
Yeah.
So
And this your cardiovascular game isn't like about get your cholesterol down or this. It's really more than likely about your autoimmune disease destroying your blood vessels.
that's what they tell me. Every single doctor there.
Okay, good.
Yeah, every single one says they're trying everything. They just can't figure it out. What part of the autoimmune, how it did it. That's what they're trying to figure
Right.
out.
Yeah, because you really had a dissection.
Correct.
That's what makes everything different. Because it's not just like a clog; it's a dissection.
Correct.
Dissection's inflammation.
They didn't know that till they saw the video. They asked us to take it to them, to pick it up, take it to them, and then he had other colleagues look at it without telling them what to look at. Just said, "Hey, take a look at this. Watch it. Tell me what you see." They all came back with it's a dissection.
Yep.
But at the hospital,
They just put in the stent.
Yeah.
they just put in the stent, and while they put in the stent, is when I got the other dissection.
Right. So just the.
But they thought it was only one dissection
Right.
after.
Right. I mean, your tissues are so sensitive now that just even trying to put in a stent causes.
That's why they're so worried about having to go back in over
Right.
here. So on the 15th, he's supposed to next week
We'll find
decide
out. Yeah.
if he's going to go back in or not. He says it's the last thing they want to do is go back in
Right.
because the outcomes usually aren't positive.
Right.
But he says there's really no more medications to give. I'm maxed out.
And to be quite honest, none of the medications you're doing are going to really have a direct impact on your autoimmunity. They're just going to dampen your pain.
Correct.
And
And that's what they're doing. Yeah.
And adjusting her heart rate and
Yeah.
whatever, and
Yeah.
just
But the autoimmune, and that's what they're trying to, trying to figure out. They're like, how did this where? They're trying to figure out which one. They're starting, now they're saying, okay, maybe it's this mixed connective tissue somehow, and how did it,
yeah.
they're really trying. They're really
No,
trying
like I
to
said, you
figure it
have
out.
great doctors. You have great doctors. And they're doing a great job with you. We just need to help you with your
The lifestyle.
lifestyle dietary
Okay.
preventive medicine factors
Yeah, that would be
that are
great.
personalized individual to how you're showing up with testing and other things like that.
And I'm a strong believer in all of that, especially with my mom everything was natural. Find
Yeah.
natural ways to do it.